Hi, I'm Dr. Sarath Jakka, DNB trainee, Rheumatology at Narayana. Today we have with us Dr. Pradeep Kumar, Senior Consultant, Rheumatologist at Narayana. Today he will be answering questions on various aspects of rheumatology. Hi sir.
Hi.
Sir, what is rheumatology?
Rheumatology is a very under-recognized specialty. It deals with musculoskeletal problems and also several immunological problems, what we call as autoimmune diseases. In the Western world, if anybody gets any musculoskeletal pain, they always go to rheumatologist in the beginning. But here, unfortunately, they go to the orthopedic surgeons. Mostly they have to see us, and if we think they need an operation, then you have to go an orthopedic surgeon. So orthopedic surgeons, as the name says, it's a surgeon. They are surgeons. We rheumatologists are physicians dealing with the musculoskeletal problems.
Yes sir. And the second thing, what are the differences between rheumatoid arthritis and osteoarthritis?
Yes, thank you. There are two major kinds of arthritis, rheumatoid arthritis and osteoarthritis. Osteoarthritis is the arthritis which most lay people know about, where they call it generally as arthritis, where age is a major factor, which means the elderly, the older people getting arthritis are usually known as osteoarthritis. Rheumatoid arthritis, on the other hand, can happen at any age groups. It can happen even in children. So this is an inflammatory arthritis, what we call, which means there's a lot of inflammation, which means the joints will look red, swollen, and very stiff. And it can rapidly cause deformities and will limit the patient's daily functions. Osteoarthritis, on the other hand, predominantly affects the knees in an elderly, and that is due to degeneration, what we call, which is wear and tear. But rheumatoid arthritis is inflammatory arthritis, which is very aggressive.
Thank you sir. Sir, are there any other types of arthritis?
Yes, there are several types of arthritis. Contrary to what Ayurveda believes that there are three kinds of vatas, we have nearly 100 kinds of arthritis. And that is why it is important to differentiate, come to a rheumatologist and differentiate which kind of arthritis you have. The common ones are, as you already said, rheumatoid arthritis and osteoarthritis. But another most common arthritis we are seeing in India is chikungunya arthritis, where mosquito bites will cause high fever followed by severe crippling joint pains with stiffness and leg swelling, which is also very under-recognized. Patients spend a lot of money going to different hospitals and getting all sorts of tests done and still being very crippled. And it is important for these patients to see a rheumatologist and get the right treatment, which might involve just taking one steroid injection. And there are so many other, like psoriatic arthritis, reactive arthritis. There are so many, as I said, there are hundreds of them which we can list. And we know how to recognize them through the pattern. Thank you.
Sir, can young people develop arthritis?
Yes, I think I did briefly touch upon that earlier on. Not the osteoarthritis, but rheumatoid arthritis and other kinds of inflammatory arthritis where there's a lot of inflammation can develop in any age groups. So children get it, in which scenarios we call it as juvenile idiopathic arthritis. And it is also rising. Quite commonly nowadays, lots of children are having joint pains and swelling. So don't ignore if your children are complaining of joint pains as just growing pains and just leave it as it is. Because if you don't recognize this and approach us early on, in children, the growth will be affected. So that is the difference between children developing arthritis and adult. In adult, it is only the pain, disability, but in children, their growth itself is affected. So if they have arthritis of a knee joint, then one leg will not grow and the other will grow, and they will actually start limping for the rest of their life. And so it is extremely important to recognize arthritis even in children.
Yes sir. Sir, is there a cure for arthritis?
Again, I think you have to specify a bit more depending on which kind of arthritis. Obviously, if it is age-related arthritis, there is no cure for aging so far. But the inflammatory arthritis we are talking about, several of them, we are talking towards near cure. The earlier you see a rheumatologist and give a special treatment for these conditions called disease modifying agents or biologic agents, then there is a chance of a cure. So it is extremely important you see us earlier on and get these right treatments and go towards a cure. Unfortunately, if you present to us much later, definitely there is no cure, but still there is a huge hope that you can live a normal life with the treatments which we have currently. And the medicines in the last decade or two in rheumatology field has advanced so rapidly, second only to cancer specialist, cancer medicine. We have lots of medicines to treat this inflammatory arthritis. Thank you.
Sir, what about diet and arthritis?
This is a common question we get in my routine clinical practice. That is because Ayurveda strongly believes in dietary influence on any conditions, not just arthritis, almost every condition. They believe that diet can alter. But unfortunately or fortunately, we don't know. Our science does not believe that diet can change in a major way once you have developed the arthritis. But having said that, we do believe that diet can influence your normal health and preventing you from getting any serious diseases. So I think diet and any health, you have to think of from the prevention point of view. But expecting a diet to change your disease is a bit far of expectation. And I always give this analogy that a car is made of several million parts, and so is a human body. And whenever the car stops or whenever the human body gets a disease, if you think that if you fill the petrol, that the car will run, and same thing, if you change the diet and your body will run, is not the right approach. But of course, petrol is important. Of course, diet is important for a body. But I think once you develop the disease, the influence of diet on any of these chronic diseases are going to be very minimal, and the effect of medicines on these conditions are maximal. And so we have to concentrate on that which has a maximum effect rather than the minimum effect.
Yes, sir.
Thank you.
And what about the exercise and arthritis, sir?
Exercise in almost all kinds of arthritis are beneficial. So yes, we do recommend exercise. And when you say exercise, we are not just talking about building muscles like how the gymmers do. We are talking about aerobic exercises, which means anything which increases your oxygenation. For example, a brisk walking. So you can have arthritis of your knee joint, and we are not expecting you to do only the knee exercise. Actually, you have to do something like walking, running, jogging, skipping, or swimming, where your breathing rate goes up, and that improves your oxygenation. And once your oxygen levels in the blood are quite saturated, significant enough, it will help the healing process of the joints. This is same for most of the health conditions. So you have to be aware that it's not just strengthening muscles, it is actually improving your cardiorespiratory status by just doing brisk walking is helpful in almost all kinds of arthritis.
Yes, sir. And so what are these autoimmune diseases, sir?
Yes, that is another major field which we deal with, where there is very poor awareness apart from the musculoskeletal problems. So in our body, we have immune system like how we all know, and there's a lack of immune system why people are dying with coronaviruses. So this immune system should be able to recognize what is normal and what is not normal or serious. And in some patients, due to several reasons, this immune system is not able to recognize the normal process and the abnormal process. So it will think that the normal process, for example, your own joints or your own skin or your own muscles are actually a virus or a bacteria, or it's foreign, which means it doesn't like that. So the immune system will start destroying these parts of the body, and then you get disease, which means it can affect any part of the body. So that is why we rheumatologists don't deal with a single organ. So we are not a liver specialist or lung specialist or a heart specialist, but we deal with immune system. And if it affects the heart, then they can get inflammation in the heart, and we deal with that. If it affects the lungs, they can get inflammation in the lungs, and then we deal with that. If it affects the joints, and that is rheumatoid arthritis or few other arthritis, which we call it as an autoimmune arthritis, and we deal with that. So that is autoimmune diseases.
So one last question for today. So what are these biological drugs?
Yeah, good question. You have done some updates with the rheumatoid arthritis treatment. Biologic drugs have revolutionized the treatment in rheumatology. So in olden days, we used to use just the older kind of medicines for treating almost all kinds of this inflammatory arthritis and autoimmune diseases. But now we have this biologics, which means it is taken from a biological process. And these things, which is commonly an injection form, are very effective in treating this arthritis and autoimmune diseases. And these are the medicines which has now made us talk about near cure of this condition. So they are unfortunately expensive, but India being the leading manufacturer in the world, the cost of these injections are coming down quite rapidly. When I started practicing rheumatology, one of these biologics called anti-TNF injections were costing about 1 lakh in 3 months. But now we have drugs which can cost only like 15,000 a month. So, and the cost keeps coming down, as I said, with the increasing competition. And these are very effective in treatment. People do believe that these biologics are not safe. Contrary to this belief, actually this novel technology and this novel advancement in medicines have improved the safety significantly. It is like driving a Ferrari and driving a normal Maruti Suzuki car. So which is safer? Ferrari is much safer, but it is very costly. But this is not as costly as Ferrari, but extremely safe. So those are biologics.
Thank you, sir.